William McLaren's family dialed 911 Thursday morning after his stomach pain turned unbearable.
We waited and we waited and we waited and the ambulance didn't come.
The McLarens claim it took EMS workers more than 30 minutes to get to their house. And when they showed up, the family says paramedics refused to transport William unless they paid cash because it wasn't considered an emergency and Medicaid wouldn't pay for the ride. William says he had a twisted lower intestine that could have ruptured.
The personnel at the hospital, of course, treated it as if it were an emergency. And when the doctor got the x-ray, then he knew it was an emergency.
Fort Smith EMS says they're required by law on non-emergency calls to let people know if Medicare won't pay the bill. EMS workers say not every 911 call they receive requires a trip to the hospital.
People like to use this as their taxi service.
Fort Smith EMS prioritizes their calls. Dispatchers ask people a series of questions to determine how serious their injuries are.
If a higher level priority comes up, that unit that's closest to that highest priority is going to be rerouted to that emergency, and then someone else will be assigned the lower priority.
Even if a call isn't an emergency, Fort Smith EMS says they still dispatch an ambulance immediately. In Fort Smith, Mallory Cook, 5 News.